So welcome back to In Your Neighborhood. I'm your host, Charlotte Brown, and on today's show, we've been talking with Elevate NWO. My guests today have been Aaron and Eric, and telling us all about all the great services that they provide there and the great work that they do in the community. So we left off, we were talking about stigma and just kind of, you know, one of the things that always evolves with that is people thinking about how can I get this? So maybe we can touch on, you know, how you can get HIV and hepatitis C and how you can't.
Well, I mean, there are different ways that you can. So let's maybe talk about, separate them because they are different. I did mention before that both HIV and Hep C are bloodborne viruses. So let's look at HIV. So how you can get it through drug use, injection drug use is a big thing.
Yeah, sharing equipment.
Sharing equipment is a big one. You can get it through sex. So a big way is anal sex is quite a way of getting it. As well, it can be passed through transmission from mother to child in childbirth as well as in breastfeeding. But for all these things, there are not new, but there are ways of really reducing the risk of getting that. So for drug use, we always say use new all the time. So we take a harm reduction philosophy and approach to it. You always use new all the time. For sex, there are a couple other ways now. There's something new called PrEP, which is PrEP and PEP, which are pre-exposure prophylaxis and then post-exposure prophylaxis. Basically, it's a medication that you would take every day, and that really kind of reduces your risk of
contracting HIV. Yeah, if you're in a high-risk situation.
Right. Or if you or PEP, which is again, it's just a drug regimen that you take right after an event might have happened that you feel like you might be exposed to HIV, and so those are ways as well. For mother and child, it's about getting the mother on treatment and really driving the counts down, because it really is. It's a bit technical. Basically, it's how high the viral count is in the system, which really kind of affects how much can get transmitted.
Right.
So for Hep C, it's only blood to blood. So we find it's the drug use, but unsafe tattooing practices and body piercing practices. HIV is also that way. Less. Those are kind of the main things. The other ones are, maybe through sharing some, clippers or razors or toothbrushes. But that's kind of lower risk. There is some risk in when you have sex, if there's rough sex or anal sex, that there might be blood involved, that there might be some ways that could be passed, but those are kind of medium to lower. They're really lower risk. But what's most important to know is how you can't get it. That we find, and this goes talking about stigma that really affects it. So you can't get it from a hug, a kiss. We've had campaigns about that on local television, on the billboards. You won't get it through sharing utensils or or toilet or bathroom. You can't get it through mosquitoes. Now with the testing of the blood supplies, if you do a medical procedure, it's you're not going to be able to get it because the blood supply is tested for HIV and for Hep C.
And for people living with HIV and that are on therapy and taking treatment actively, their viral load is so low that it's really, really hard for them to pass it on to another person as well. So that's why getting people tested, getting people informed, part of that 90-90-90 cascade that we're looking at for HIV, getting 90% of the people found out that they have it, getting them on treatment and getting them stabilized through that cascade is so important for us.
Right, and let's talk a little bit about the testing. Like, I'm sure somebody can go to their doctor, but you actually are doing testing now at Elevate, and kind of what that looks like.
Yeah, so that's a new thing for us, relatively new, and so now people can come to our office and get tested for HIV or Hep C or Hep B. And there are a lot of other providers out there that you can get tested, but we just want to be, one of them. Another option that people have as well. We're taking testing on the road, so we go to different agencies, and our outreach team goes and offers testing there. And we've gone on road shows, as I was talking about earlier, out in the region, And during those shows, we've also been able to offer this testing as well.
Right, right. Because
And
I
so-
guess that's probably your biggest battle, is just for people to get tested and find out, because once you know, like, there's a lot of options to be able to live a long, amazing life,
Really, there
right?
is. And it's with our team, and we've got it's a lot of support staff, our case managers, our nursing team, our outreach workers. So as soon as you get your diagnosis, like you test, you get your result. If it's a positive test, we can link you up to care right then and there. Start the intake, have an appointment with a nurse or with your doctor, get you on a treatment, or at least work towards getting you stabilized to get you on treatment. And so it's very seamless and very quick once you do get a positive diagnosis.
Absolutely. And it looks very different now, I'm sure, say in the 80s, what treatment and what life was like compared to now. So let's talk about that now in terms of, the treatments that's available for both HIV and hepatitis C, and kind of, what that daily life looks like.
Certainly. So for someone living with HIV, 20 years ago, it was there were a lot of exploration, what worked, what didn't work. It was very rough, a lot of side effects. And the treatment themselves, sometimes people were taking, 20 plus pills a day, very harsh regimen. You had to take it, every certain time every day. It was very difficult to comply with med adherence at that time. Today, people living with HIV are predominantly taking ART, antiretroviral therapies, 1 to 2 pills a day, suppresses the viral load, very, very few or very minimal side effects as a result of that. For hepatitis C, also been just recently, last couple of years, a big change in therapies. 4 or 5 years ago, treatment was 6 months, sometimes longer, of a very harsh, chemo-like treatment that was a lot of side effects, fatigue, nausea, very debilitating. People were kind of locked to their couch or to their bed for the course of that treatment. And we still have 1 or 2 people that would have to take that just based on the genotype of the virus. For the most part, though, just in the last year or two, and actually a new medication is being released now, people are on treatment for as short as 8 weeks, 1 pill a day. Sometimes there's a 16-week regimen, or I think 8, 12. It depends on the genotype, on the liver score, what damage is there, but the side effects are few. People are enjoying a higher quality of life. And the clearance rates are much higher. The treatment I mentioned that was 5 years ago for hepatitis C had a clearance rate of 60%, 65%. The adherence rates of the medications available now were as high as 97, 98. So people are kind of mentioning cure in the same voice when they're mentioning the treatment for hepatitis C. Yeah, really good news.
Wow.
So you can get rid of it. That's the story for
hepatitis C specifically.
For hepatitis C.
Yes.
And so
and what's exciting about the with HIV now, people living with HIV, it's no longer a terminal illness. You're on the treatment, you have your med adherence. It's now been downgraded to what did I call it? A chronic disease, and it's one that people are living full lives now. So we're looking. One of the issues we're now faced with, thankfully, is HIV in the aging population, and that's 20 years ago people were looking at weeks or months, and now we're looking at full length life. So.
Right.
Yep.
Good. Well, we're going to take another quick break, but we're going to be right back with Iyn and Eric and talk more about Elevate and WO.